Diet for inflammatory bowel disease. Hello and welcome back to the channel. I am Dr. Zubin Dev Sharma and I am a gastroenterologist and hepatologist. Today we will cover a very specific question that is asked very frequently to us in our daily practice. Today we will cover diet for inflammatory bowel disease and how diet really works in both managing the disease as well as maintaining the nutrition of a patient who is suffering from inflammatory bowel disease. Let's talk about diet in IBD. As you all know, IBD belongs to a category of diseases which can manifest in many forms. There are two principal forms which IBD presents with. The first one being Crohn's disease, and the second one being an ulcerative colitis. In a very basic way, Crohn's disease can affect all over the GI tract, anywhere from the mouth till the anus, whereas ulcerative colitis usually restricts itself to only involving the large intestine. Crohn's disease presents with much more malabsorption, with much more anemia, with much more worse symptoms of small bowel, whereas ulcerative colitis presents more with diarrhea, which is bloody, and increased number of stools in a day, including in the night, and sometimes pain. Crohn's may actually have a different kinds of behavior depending on patient to patient. It can cause severe pain and sometimes may require surgery also. So let's talk of diet one by one for both of them. Let's first talk of Crohn's disease because that is much broader in its context. So, as I said, Crohn's disease can present in various ways. It has predominantly three different ways of presenting. One thing is going to present with diarrhea and evidence of malabsorption. When I say malabsorption, I mean that the food material, the content is not really getting well digested into your body. The second context being, somebody who's having recurrent obstruction of the intestines, recurrent pain in the abdomen because the disease is causing narrowing in the intestinal tract, something which in medical language we refer to as strictures. So these two are broadly two various kinds where Crohn's can present, and the third type really can be a mixed form of this, and along with something called the fistulae. So if you have the first variant of Crohn's disease, that is when you have diarrhea, you have malabsorption, the principal focus that remains is to provide adequate nutrition to the patient so that they do not lose their essential nutrients. Total enteral formulas are sometimes used as a part of treatment, particularly in pediatric age group patients or young kids when they have Crohn's disease. But otherwise, what we usually ask the patient to keep, is away from milk to some extent. They can use milk products like curd or cheese, and otherwise they have to have a high calorie, high protein diet to maintain their nutrition. And particularly they have to be wary of that they should have all the essential nutrients, all the vitamins and minerals in your diet if you are looking for a good diet in IBD. Second time, when if you have the second variant, that is the penetrating or the structuring one, where there is narrowing in the intestine and you're having recurrent pain abdomen. In those cases, we usually ask the patient to stay away from fiber. When I say fiber, I mean things like fruits, things like green leafy vegetables, anything that contains a lot of fiber should be avoided in a patient who has a structuring Crohn's disease, or sometimes it can cause a total obstruction, and that will be quite painful for the patient. Finally, if you have the last type of an IBD, that is the ulcerative colitis. In ulcerative colitis, the predominant problem is again diarrhea along with blood. So diet has some role in it to some extent, but it is quite limited. It's not as extensive as Crohn's disease, but it still has a role. During acute flare episodes, you should ideally avoid things like a lot of milk intake, and lot of raw vegetables or salads needs to be avoided, because you don't want to increase a flare by causing some infections from that, and you don't want to confuse the flare with lactose intolerance that is pretty common in adults, particularly in Southeast Asia. So if you have Crohn's or if you have ulcerative colitis, there are certain things which you have to tweak in your diet to really maintain your illness. But having said that, it does not mean that you should be completely off diet. It does not mean that you should be on boiled vegetables. It does not mean that you should avoid significant changes in diet. Just keep a healthy diet with a few tweaks and you will do well even if you have are you living with IBD? So for any further questions on diet and inflammatory bowel disease, please feel free to ask us. We'll definitely answer your question.